Are you struggling to climb stairs without that familiar ache? Does getting out of a chair feel like a monumental task? You're not alone, and here's the thing. It's not just age creeping in. Persistent knee pain isn't something you just have to live with. It can steal your independence, limit your ability to enjoy time with loved ones, and seriously reduce your quality of life. But listen closely, because I'm Dr. David Thompson, and as a health expert dedicated to helping seniors thrive, I'm here to tell you the good news. You can turn this around with simple, scientifically backed changes you can start today. Stick with me until the end, and let me know in the comments if this sounds familiar. Tip 1. The power of anti-inflammatory foods. Let's start with something you do every single day. Eating. You see, one of the shocking reasons your knee pain never truly goes away is often chronic inflammation. Think of it like a low-grade fire burning in your joints, and what you eat can either fuel that fire or help put it out. Here's the thing. Many common Western diets are loaded with inflammatory foods like highly processed snacks, excessive sugar, and certain oils. But the good news? You can actively fight inflammation with delicious everyday foods. Take berries, for example. Blueberries, raspberries, strawberries. These little powerhouses are packed with antioxidants called anthocyanins. Studies like those published in the Journal of Agricultural and Food Chemistry show these compounds significantly reduce inflammatory markers in the body. Imagine starting your day with a handful of these in your oats instead of sugary cereal. It takes mere seconds and tastes fantastic. Then there are omega-3 fatty acids. You'll find these heroes in fatty fish like salmon, mackerel, and sardines. If you're not a fish fan, flax seeds, chia seeds, and walnuts are excellent plant-based sources. Omega-3s work by helping your body produce compounds that actively reduce inflammation. A study from the Annals of the Rheumatic Diseases highlighted how regular intake can significantly decrease joint pain and stiffness. So next time you're planning dinner, consider swapping out that processed meat for some baked salmon. This simple change doesn't just help your joints. It's fantastic for your heart and brain too, keeping you moving freely and enjoying life with your grandkids for years. Tip 2. Gentle movement is medicine. Now I know what you might be thinking. Exercise with knee pain? You must be joking. But here's where it gets interesting. Contrary to popular belief, often the worst thing you can do for knee pain is stop moving. Your knees need movement to stay lubricated, to strengthen the muscles that support them, and to improve blood flow for healing. Of course, we're talking about gentle, appropriate movement. High-impact activities might be out for now, and that's perfectly fine. Simple, low-impact exercises are your best friends. Think walking. Even just 15-20 minutes a day can make a world of difference. It strengthens the muscles around your knees, keeps the joint fluid flowing, and helps maintain cartilage health. A study in arthritis and rheumatology found that even moderate walking significantly reduced the risk of knee osteoarthritis progression. Picture enjoying a morning walk in the park without stiffness. That's the goal. Another fantastic option is water aerobics or swimming. The buoyancy of the water takes the pressure off your joints while allowing you to move through a full range of motion. Even seated exercises, like leg lifts or gentle knee bends, can build crucial strength without impact. The key is consistency and listening to your body. If it hurts, stop or modify. You'll be surprised how easy it is to incorporate short bursts of movement throughout your day. Take the stairs instead of the lift sometimes, or walk to the corner shop instead of driving. These small habits don't just help your joints, they boost your overall energy and keep you feeling younger. Tip 3. Stay hydrated for joint health. Let's move to tip number 3, and this one is so simple, yet so often overlooked. Staying properly hydrated. Think of your body as a complex machine, and your joints are like hinges. Just as hinges need oil to move smoothly, your joints need adequate fluid. The cartilage in your knees, which acts as a cushion, is about 70–80% water. When you're dehydrated, that cartilage becomes less elastic and more susceptible to damage and pain. Here's the thing. As we age, our sensation of thirst can diminish, making it easier to become chronically dehydrated without even realizing it. The synovial fluid, which lubricates your joints and nourishes your cartilage, also depends heavily on your hydration status. When you're well hydrated, this fluid is more effective at reducing friction and absorbing shock. So, how much water? A good general guideline is around 8 glasses, roughly 2 liters of water a day. But listen to your body and observe your urine color. It should be a pale straw yellow. You don't have to chug it all at once. Keep a water bottle handy and sip throughout the day. Add a slice of lemon or cucumber if plain water isn't exciting enough. Remember, tea and coffee don't count towards your total as they can have a diuretic effect. This habit doesn't just help your joints, it improves digestion, skin health, and energy levels. It's a foundational habit for feeling your best. If this is news to you, make sure to hit that like button and subscribe for more essential health tips. Tip 4. Boost your vitamin D. Now let's talk about a silent hero for your bones and joints. Vitamin D. This isn't just a vitamin. It's a hormone that plays a crucial role in calcium absorption and bone health. Many people, especially seniors in places like the UK, Australia, and the US, are surprisingly deficient in vitamin D, particularly during winter months or if they spend a lot of time indoors. And here's the kicker. Low vitamin D levels have been linked to increased joint pain and a higher risk of osteoarthritis. How does it work? Vitamin D helps regulate calcium and phosphate in the body, which are vital for maintaining healthy bones. Stronger bones mean better support for your joints. Beyond that, vitamin D has anti-inflammatory properties that can directly benefit your knees. A meta-analysis published in the Journal of Clinical Rheumatology highlighted the strong association between vitamin D deficiency and chronic musculoskeletal pain. The best source of vitamin D is sunlight exposure. Just 15-20 minutes a day, especially in the mid-morning or late afternoon, can make a difference. But if you're in a less sunny climate or have concerns about sun exposure, certain foods like fortified milk, cereals, and fatty fish also contain it. You might also consider a supplement, but always consult your doctor before starting any new supplement, especially to determine the correct dosage. Getting your vitamin D levels right doesn't just protect your knees. It boosts your immune system and your mood, helping you enjoy those active days even more. Tip 5. Mind your posture. Our fifth tip brings us to something we rarely think about: your posture. Here's the thing. How you stand, sit, and even sleep can put unnecessary stress on your knee joints, contributing to wear and tear and pain over time. Imagine carrying a heavy backpack. If you slouch, your entire body compensates and certain joints like your knees take the brunt of it. Poor posture can lead to misalignments throughout your body, causing uneven pressure distribution on your knee cartilage. For instance, if you slouch forward, your pelvis tilts, and your knees might rotate slightly inward or outward, creating abnormal stress. Over years, this cumulative stress can accelerate cartilage breakdown and inflammation. Studies in physical therapy journals consistently show how proper body mechanics are crucial for joint preservation. So, what can you do? Be mindful of how you sit. Ensure your feet are flat on the floor, your back is supported, and your shoulders are relaxed. When standing, try to keep your weight evenly distributed, imagining a string pulling you gently upwards from the crown of your head. Even simple adjustments, like placing a cushion behind your lower back when sitting for long periods, can make a huge difference. Practicing gentle stretches that improve core strength and flexibility, such as those found in gentle yoga or Pilates, can also significantly improve your posture and reduce the strain on your knees. It's a small change with huge long-term benefits for staying active and avoiding pain. Tip 6. The importance of healthy weight. Finally, let's talk about the significant impact of maintaining a healthy weight. This might seem obvious, but its importance for knee health cannot be overstated. Every extra pound you carry translates to several pounds of additional pressure on your knees when you walk, climb stairs, or even just stand. For example, losing just 10 pounds can reduce the load on your knees by 30 to 60 pounds with every step. This constant excessive pressure accelerates the wear and tear on your cartilage and joint structures, increasing inflammation and contributing significantly to pain and the progression of conditions like osteoarthritis. Research published in Arthritis Care and Research repeatedly demonstrates that weight loss is one of the most effective non-surgical treatments for reducing knee pain and improving function in older adults. The good news is that even modest weight loss can bring substantial relief. You don't need to aim for dramatic changes all at once. Combining the dietary advice we discussed earlier, focusing on anti-inflammatory, whole foods, with gentle, consistent movement, is the most sustainable and effective path. Swap your usual afternoon biscuit for a piece of fruit. Choose water over sugary drinks. These small, consistent choices add up. Achieving and maintaining a healthy weight doesn't just alleviate knee pain. It drastically improves your overall health, boosts your energy, and helps you enjoy a more active, vibrant life for many years to come. So there you have it. These 6 powerful yet simple habits, embracing anti-inflammatory foods, engaging in gentle movement, staying hydrated, boosting your vitamin D, minding your posture, and maintaining a healthy weight can truly transform your knee health, energy, and overall mobility. Imagine chasing your grandkids across the park without a twinge of pain, enjoying those long walks you once loved, or simply moving through your day with ease and confidence. These steps aren't just about managing pain. They're about reclaiming your active life and feeling younger. Which tip are you excited to try first? Drop it in the comments below. I love hearing from you. If you found this video helpful, please give it a thumbs up, subscribe to my channel for more scientifically backed health advice for seniors, and hit that notification bell so you never miss out. This is part 2 of our Health After 60 series, so make sure to check out part 1 here if you haven't already. And don't miss my next video. Doctors warn, stop eating this if you want to protect your knee cartilage. You won't want to miss it. See you next time.